Hi, I'm Paul Feiner. I'm Greenburgh Town Supervisor.
I'm Daphne Luciano.
And I'm Henry Pete.
Great, and we have a great interview with Judith Watson, who's the head of our local health center network. And Daphne and Henry, you want to take it on?
Yeah, so today we're going to be discussing new federal policies and how they have affected vital programs like Medicaid and local resources such as the Greenburgh Health Center. So on July 4th, a new federal bill was signed into law. Building on the 2017 Tax Cuts and Jobs Act, the bill increases funding for border security, defense, and energy production. However, this comes with reduced spending on safety net programs like Medicaid and SNAP, which stands for Supplemental Nutrition Assistance Program. These cuts could impact millions of low-income and disabled Americans, with estimates suggesting over 11 million people may lose health insurance coverage in the coming years. Reductions to SNAP could also increase food insecurity and diet-related health issues. While long-term effects remain to be seen, the bill may have serious consequences for vulnerable populations, including the elderly.
Like Paul said before, we are joined by Judith Watson, CEO of Westchester Community Health Center and head of the local Greenburgh Health Center on Knollwood Road. The Greenburgh Health Center is a pillar of our community, leading with service, heart, and strength as it supports low-income families and individuals with disabilities right here in Greenburgh. Judith is here to share how recent federal policy changes may impact the center's ability to continue providing these essential services. All right, so if you're ready, we get into the questions.
Absolutely. Thank you for having me.
All right, thank you for coming. So what kind of work does the Greenburgh Health Center do on like a day-to-day basis?
So the Greenburgh Health Center is one of 9 sites that are operated by the Westchester Community Health Center. And we are a group of federally qualified health centers that's located throughout the county of Westchester, located in some of the most difficult areas, right? Where there are lots of low-income folks in need of our services. And specifically, we're in Mount Vernon, which is where our lead organization is, and we're in Yonkers and White Plains and Valhalla. We have homeless sites. We have school-based health center sites. And what we do, born out of the civil rights movement, is we provide health care services regardless of ability to pay and regardless of immigration status. And we've been doing so for over 51 years. And so we're a one-stop shop: internal medicine, pediatrics, OBGYN, dental, behavioral health, or mental health services. You name it, we provide the services within our ecosystem.
Amazing.
And I should mention, they're, of all the not-for-profits that I deal with, they're the best. And I'm saying that on TV, so I can't say that another group is the best because I'm already recorded.
Thank you, Supervisor Feiner.
I mean, he's right. It definitely sounds like you guys are vital to the community. So what kind of federal assistance programs would you say are most important to the people that you work with?
So primarily Medicaid.
Yeah.
We are in a federally qualified health center, so again, we receive federal funding. And in the case of Westchester Community Health Center, it's close to $10 million that we receive in funding from the federal government in order to operate, right? And we've been doing so since the 60s. Now, our patients, about 70% of them are covered by Medicaid, one form of Medicaid, whether it be straight Medicaid or Medicaid managed care, right? So 70% of our patients will be impacted by the changes that are impending. So to your question, it would be Medicaid mostly, some of our Medicare patients. Most of our patients are eligible for SNAP benefits and some of the other benefits that I know that we'll talk about this morning.
Very interesting. Thank you for sharing. So what are the most common health concerns you see at the Greenburgh Health Center, and how would a cut in Medicaid affect these sort of concerns?
So the patients who are served by the health center are primarily low-income folks who are disproportionately impacted with issues such as diabetes, hypertension, cardiovascular disease, kidney disease, asthma. You name it, they're disproportionately impacted with these illnesses.
Yeah.
And so, the changes, the bill, and it's all being unraveled as we speak, will significantly impact those patients who are coming in to access the services, because a lot of them will no longer be eligible for Medicaid. Like I said, 70% of our patients are covered under Medicaid, so they won't be eligible, which means you're going to have a lot of sick folks walking around with no access to care. The services are there, but will we be able to provide the service? Therein lies the question.
Yeah. So would you say that the changes to the work requirements will heavily affect the people that you work with and your clients?
Absolutely, and you all are going to have to give me a minute to explain this, right? Because most people don't understand the way it works, right? So when you are on Medicaid, which Medicaid is health insurance for low-income people, Medicare is insurance for elderly people, right?
Okay.
So with regard to eligibility for these programs, Medicaid in particular, the recipients need to produce documentation annually, and that has changed, and I'll talk about that. But annually, that documentation has to be provided in order to deem you eligible to have Medicaid. You follow me? And so, because for one reason or the other, folks have not been able to produce that document, right? At any given point, someone who's a United States citizen who's eligible for Medicaid is uninsured because they cannot produce the documentation. Why? Because they've changed their telephone number. They may not have all of the necessary paperwork necessarily available. They may not be responding expeditiously to the request for this information, right? And so that's what health centers were born out of, that fact that at any given time, someone who's eligible doesn't have it. So now what have we done in the big, beautiful bill? We've made it so that that requirement is twice. So if you can't produce it once a year, how then will we expect that you'll be able to produce it twice a year? Do you see?
Yeah.
So what will that result in? Uninsured people, right? More people with no insurance.
Exactly. It's a very serious concern, I bet. So how have recent changes in federal tax policy affected your clients' access to healthcare or support programs? I know you kind of just touched on this.
Here again, so about 70% of our patients have Medicaid, but then there's 30% of our patients who have commercial insurance. A lot of our patients have their homes, right? They own their own homes, right? We have lots of patients with commercial insurance as well as Medicaid, and they own their own homes. And so, of course, their tax implications, right? I know that with regard to SALT, the number has been increased from $10,000 a year up to $40,000, and so for some, I think that's a good thing.
Yeah, and we touched on this before, but how do stricter eligibility rules for SNAP, for example, impact some of the families you work with?
Yeah, they're now ineligible, right? They will not have access to SNAP, and for a lot of people who are not familiar with SNAP, this is food stamps. These are food stamps, right? People who've been around for a long time, they know food stamps. When they hear SNAP, they don't really know what SNAP is, but these are food stamps. And so similar to Medicaid and some of the other programs, folks will be ineligible and therefore have to figure out a way how to exist without these programs. And that's what we're all struggling with as a society.
And so on that note, summarizing kind of all the things we've talked about, in your view, what should policymakers and lawmakers understand before making changes to Medicaid?
Well, I think it's always about speaking to the stakeholders and the recipients themselves, speaking to them and really understanding their personal stories and their personal experiences, and then, to take it back. However, I think where we are now, I think we're well beyond that point. Although I think it's still important that our elected officials hear from us, and Supervisor Feiner, thanks for allowing me this opportunity to talk a little bit more about it. We can't scream it enough. Like, we have to let everyone know this is what will happen.
Have there been impacts in terms of the number of employees you have as a result of the big, beautiful bill?
Well, we at Westchester Community Health Center have had to decrease the number of staff. We've looked very carefully at our workforce, and to align with the decrease up to 14%, February was a really, really bad month for us. And to align with the decrease in visits, we've had to reduce staff, unfortunately. And that is still on the table. There still may be, unfortunately, there may need to be some additional staff reductions, expense reductions, and all of that.
I read that many hospitals all over the country are reducing their workforces. So this is not only the Greenburgh, your health center, it's all the hospitals. So does that mean that it's going to be even harder to get the service? Because traditionally, if you go to hospitals, there's not as many nurses and people caring for individuals. So do you anticipate this is going to be a quality of life problem nationwide?
Absolutely. I believe it already is a quality of life issue nationwide, even prior to July 4th of the signing of the big, beautiful bill. I think that organizations like mine and others have looked at our staffing. We've anticipated what's to come. But let me be clear also in that the bill as it stands today, there is no organization that can prepare for what's to come. I think there's going to be a huge burden on the New York State government to help us all figure this out. I think these are uncertain times. If I'm being transparent, no one can absorb the billions of cuts that are not proposed, that have been signed in this bill.
So will our state legislators and the governor come to the rescue? And will that be like a total rescue, or is it going to be, what's like the best case or realistic scenario?
So in addition to being the CEO of Westchester Community Health Center, I'm also on a hospital board. And I can tell you that the hospitals, as well as the health centers and other healthcare organizations, are all very concerned because there is not enough money that exists, not just in New York State, but in the nation, to address this budget shortfall that we're all about to experience.
Does the national or state or local healthcare organizations have like an advocacy group? Are there things that our listeners could do?
Absolutely. So health centers in particular are, we're very well organized. There are 1,500 health centers in the United States with multiple sites. So we're one with 9 sites. There's some with 100 sites, some smaller, some larger. Thousands and thousands of sites throughout the United States, again, in these low-income areas serving the populations. And so we're very organized both statewide. Our statewide association is the Community Healthcare Association of New York State, and also nationally, in that there's the National Association of Community Health Centers. And I can assure you that we've been on with them daily and the attorneys to try to sort through this and to try to make sense of this and to try to get some direction. So what can folks do? You can pick up the phone no matter where you live, no matter which community that you live from, no matter whether or not you've ever received care in a health center. You can pick up the phone and you can speak to your elected officials and you can let them know that people are going to be dying in this country. People are going to be dying in the streets if they're not able to access these vital services. The health centers are the largest primary care network in the United States. There are more patients, 32 million, I believe is at last count, of United States residents who are served at health centers. If we're not able to provide care, what will happen to our community?
Right. And what do you think are the most common misconceptions that people have about individuals who are under Medicare or SNAP benefits?
Oh, here's why I love that question. Because I always start, I'll do presentations, all over the place. And I'll say, listen, so when you think about Medicaid, you think about a Black or brown person, right? You think of someone who is poor, right? So everyone in this country knows a parent who have turned over their assets to their children so that everything that they have worked for does not go into their health care, right, in their golden years. So they've turned their assets over to their children. And guess who covers them? Medicaid. 70% of everyone who lives in a nursing home is on Medicaid.
Wow.
Do you see? And you would be shocked how many people do not know that. So when you think Medicaid, you think about, the patients who go to Westchester Community Health Center. No, they're our parents who are on Medicaid.
And that's why it's very possible that the Congress could change their mind about this, because once people see that they're not getting the service, people don't think that it's going to impact them. But when it impacts them, and it impacts members of Congress's own families and their parents, all of a sudden circumstances could change and they may reverse course.
The red states are going to be hit more so than any other state. The red states are going to be hit more so than any other state because the vast majority of their populations are on Medicaid. You see, here in New York, we think, we think New York is the United States. There's a whole country out there where there are folks who are going to be impacted by these changes.
So what the health centers have to do is they have to get a list of people, especially conservatives and Republicans, who have family members who are going to be hurt, and then have them lobby members of Congress.
Which is
Because,
exactly
right,
what we've
because
been
when
doing.
I lobby a member of Congress, it really doesn't have any impact because they know that I'm pretty liberal. Or if you as an advocate, same thing. But if we could get people who are, people who had supported the president in his election and members of Republican members of Congress, and if they start advocating, you'll see the Congress change.
If you were to take anything away from this conversation today, it would be, and Paul, it's a great segue to this, is that we cannot do this alone. It's going to take all of us doing this together.
Yeah.
Red states, blue states, it's going to have to be all of us. The United States of America. It's going to take all of us to help to get this right, back on track.
Yeah, I think that's a really important point. And I know you mentioned a few stories before, but what has been the general reaction that you've seen from your patients about this bill that's been signed?
Fear. It would have to be fear, patients and staff alike, because when you think about it, a lot of our employees, and we have over 300, they too are patients of the health center. And so fear would have to be number one, like what's going to happen? We've had to, as I said, we've had to reduce staff. So then the remaining staff, they're wondering, are we next, right? So there's fear, and then of course for the patients coming out, what's going to happen to them?
And I think, one of the differences between now and 8 years ago was 8 years ago, there weren't as many distractions. Today, the news keeps changing, so health center and healthcare, it could be front page today, and tomorrow there's going to be another issue. So it's very, very hard for the public to focus. And there's so many things that a lot of people are upset about that the media doesn't give attention to anything, really. It's maybe a one-day story, and that makes it harder to be an effective advocate, I think.
Yes, indeed. And that's why platforms such as this are so important, because I can tell you, under no uncertain terms, I've been doing this for 31 years. I've been at the health center, taking care of generations of folks in my capacity as a nurse or an administrator, taking care of these folks. And I can tell you that healthcare it has been and will continue to be significantly impacted. And again, we have to all come together to advocate for the people, because guess what? If there are people out in the streets who are without health care and they're unwell, they're going to make you sick. They're going to make us all sick. We're all going to be sick. That's a great point. And if there are people walking into hospital emergency rooms, that's going to cost taxpayers money, right? So one way or the other, we're going to pay. I pray that it's not going to be with our own health, and that's not to sow fear. That's just the reality. Just think about untreated folks walking around out there.
So what happens if somebody, has no money, they come to the health center? How do you deal with that person if they're not insured?
What we do today and what we have been doing for the 51 years that we've been in existence, and Health Center has been in existence for 60 years, we've been for 51. What we do today is if a person comes in and they do not have insurance, there's a sliding scale. There's a sliding scale that's established for those patients, and so ranging from $20 to $166. So depending on the income that you provide or lack thereof, you're assigned a fee, and that's how we provide services. And because we're a federally qualified health centers, one of the rules is we cannot turn you away. And so if you're assigned a $20 fee and you do not have that $20, we're going to care for you anyway. But those are the rules that's tied to the funding that we receive.
But what's going to happen is if you losing all this Medicaid funding, are you going to be able to sustain that, say, a year from now, because you're relying on Medicaid, aren't you, for your budget?
Absolutely.
What's like a worst case scenario? say, a year from now?
Well, the worst case scenario is that the health center closes, right? The health center closes.
can't do that.
Because exactly, and it will not happen, not on my watch, not on our watch, Paul. Do I have your commitment on that?
Definitely.
It will not happen on our watch, right? Your father wouldn't want that to happen.
No.
His father was a big supporter of the health center when it was first established. But that's the reality, and there are a lot of programs that are closing down as we speak that have already closed down. Thousands of programs have closed because their funding is no longer available, right? So we don't intend for that to be the case for our communities. We're going to continue to take care of them, and we will find a way. We'll figure out a way. Donations, right? Donations, grants, whatever we can do, because this community isn't a community without health care for all.
Have you, reached out to some of like the progressive, organizations, and are there grants that you might be able to get that you haven't gotten in the past?
Oh, everything is on the table. Everything is on the table. But understand that it's not just for us, it's for all of these organizations. So everyone is reaching out to all of these organizations for funding. But, we're taking some comfort in the fact that we're in Westchester County, one of the wealthiest counties in the world, right? In the world, I would argue. And so we're just hoping that the folks of Westchester, who we know have big hearts, and that they'll step up to the plate.
So for the health center, in terms of the budget shortfall, budget shortfalls, how many dollars are we talking about? Say for the Greenburgh portion.
Millions of dollars. There is a calculator that organizations like myself have used to determine. Right now, it's over $3 million, which is significant in a $41 million organization. So we're looking at $3 million, and that's just for one program. That's just for one of our programs.
So maybe what you should do, I'm just talking out loud, is maybe you could identify programs that are being cut, and then we could do outreach, and we could say, oh, we want to help this cause, and this is only $300,000. No, this is, and then see if we could do fundraising or identify funders. Maybe you could do that, and this could be one of the projects that I work on, in the coming years. In fact, this is something that maybe you could do is, research organizations that, potentially donate to causes like this, and then we could try coming up with ways of helping.
Absolutely.
So I think that's great. So the goal I have is I have to write a letter to your colleges telling them that you did a horrible job. So this way you could be working for the town for the fall, so I could continue this project. So
okay, sure.
Absolutely.
That's the way you have to work, right?
Yeah.
Any help that we can get. There are models that are being run because in many ways it's not easy, right, to determine who will show up, who will not show up, right? Over time, more will be revealed, and again, there are models.
So maybe you could come up with a list and maybe make it instead, because I think when you talk, we want to help the health center, it doesn't, like you said, it's not personal enough. But if basically we could say, there's programs for young mothers, there's programs for people who have heart issues, or for seniors, if we could identify different categories and then we try raising money, I think that would be good. We're running out of time. Again, if people want to make a donation to the health center, how do they do so, and what's your website?
Absolutely. www.westchestercommunityhealthcenter.org. But if you type in any one of our sites, whether it be Greenburgh or Yonkers or Mount Vernon, that information is available too.
Great.
Yeah.
What's the number again?
It's 914-699-7200. That's at our Mount Vernon site, and 914-989-7600 at our Greenburgh location.
So we'll end this by saying that I'm depressed.
Yeah.
It's a tough time. We're on meetings all day, every day, and these meetings are very somber with hundreds of people. They're very, very somber. But I have to believe that there is goodness in the hearts of everyone. and ultimately we'll be okay. I know that.
That's great. That now I'm a little less depressed. but again, I think this is really great, and I really want to thank you for all you've done. You really have been a great asset to the community, and we really appreciate the health center. And now we have another cause. We'll have to make sure that you're able to continue to do the good work that you've done, and we should be lobbying, and we should try raising funds. So if you
Thank
come
you,
up like
Paul.
with a different list, then I can make this a little bit of a project.
Absolutely.
And I think it's also good when people know that there's a cause and they can understand it.
Right.
It's not really political. This is about the health center.
Right.
And you could be a
Absolutely.
Republican, you could be a conservative,
Oh,
you
yeah.
could be a Democrat, you could be anything. But we just have to make sure the health center continues to provide the excellent service.
Thank you.
Thank you
Thank
so
you so
much.
Thank you both.
Thank you.
This is great.
Thanks.
Thank you.